When we started on this road, we found there was a lot of research on integration, descriptions of integrated delivery organizations, frameworks for integrating services, lessons learned, good and bad, case studies, international comparisons, but hardly any of the research looks at the integration of care through the eyes of patients and their caregivers, and thus we decided this would be our starting point. Along with the focus groups that we did across the province, we also undertook a systematic literature review and a general population survey to provide further data on how well integrated patients and caregivers perceive their care to be. The results in the report are not meant to assign blame or to finger point. Healthcare delivery in Ontario in 2008 is complex. It involves many people in different physical locations, all working flat out. A mix of providers, planners, case managers, and health professionals, all with different accountabilities, and multiple information systems that are not yet speaking to each other. These results are meant to offer a picture of what patients are experiencing today. They have reasonable expectations of the system. They strongly support their healthcare providers and professionals, and they understand the government's difficulty in directing more and more resource to healthcare. But they can also see where things break down. In the words of one citizen, sometimes the process just doesn't make sense. Couldn't it just be a little more logical? For patients, there really isn't an end point. Those of us working in researching and writing about the system often use terms like episodic care, but patients don't see it like that. They are attached to the healthcare system for life, and our results underscore their feelings that at certain points they've lost a little bit of that attachment. We found 4 general themes coming out of our research, and I'll just spend a minute on them. And these are areas that were identified in the general survey, the focus groups, and the literature as ones that patients find particularly problematic. First was navigating the system, knowing who to call, what to ask, how to move from provider to provider and back again, connecting the hospital process with the community process, organizing services in one's own home. Not so simple. More than half the people in our survey were not sure if there actually was one person responsible for coordinating their care. The second theme was dealing with repetition, redundancy, and delay, having to repeat medical histories, symptoms, medication lists, or showing up for booked appointments only to find a vital piece of information was missing and they had to rebook. Very common situations. 41% of the people we surveyed felt that the healthcare system did not actually value their time. And the biggest and strongest theme was anxiety about communication, wondering whether the necessary information had been transferred from one provider to another or one setting to another, not being clear about whether they were supposed to do something next or their healthcare provider was going to do something next. Who exactly was responsible for what? 41% of the people we surveyed reported that they were not confident that their healthcare providers actually had access to all the necessary information related to their health. And the fourth theme was really an exacerbation of the previous 3 at points of transition. So when moving from one provider to another, this is when these problems appeared to be heightened. Obviously, accelerated investments in integrated information management systems will solve some, but not all, of these issues. Much of this is local, about healthcare organizations and professionals thinking how they might make the patient journey a bit more logical, and then being given the freedom to make that change. Over the next year, the Foundation will continue its focus on integration and its focus on patients as we undertake further work. I hope you enjoy the report. Thank you.